So I was reading about bacterial tracheitis, and it's a really serious condition in young kids.
Oh,
It's
really?
actually quite alarming.
Bacterial tracheitis? What's that exactly?
It's an infection of the trachea, the windpipe, and it's usually caused by Staphylococcus aureus bacteria.
I see.
It's rare, but dangerous.
Isn't that the same bacteria that causes staph infections?
Yes, exactly. After a simple cold, these bacteria can invade the trachea.
That's
It's like when a
concerning.
small leak leads to a big flood.
So what symptoms should parents be aware of?
At first, it's mild, cough, runny nose, but then it escalates to high fever, severe cough, and difficulty breathing.
That sounds serious.
Stridor, a high-pitched breathing sound, can also develop.
Stridor? Isn't that a sign of airway obstruction?
Exactly. In young kids, their airways can swell rapidly, blocking
Oh,
airflow.
wow.
It's like trying to breathe through a straw that's being pinched.
But couldn't these symptoms be mistaken for croup?
Good point. While they're similar, croup is viral and usually less severe.
I understand.
Bacterial tracheitis progresses faster and is more dangerous.
Are antibiotics the main treatment then?
Absolutely. Intravenous antibiotics are essential to fight the infection. Time
Makes
is of the
sense.
essence.
How do doctors confirm it's bacterial tracheitis?
They listen to breathing, may use x-rays or perform an endoscopy to look inside the trachea.
Is that safe?
They also take cultures to identify the bacteria.
Endoscopy sounds invasive. Is it really necessary?
While it's invasive, it's crucial for an accurate diagnosis.
I
The
suppose so.
benefits outweigh the risks.
Besides antibiotics, what else is involved in treatment?
They might need to intubate the child to keep the airway open. It's
That's
vital to
serious.
prevent respiratory arrest.
Intubation seems extreme. Can't less invasive methods help?
When the airway is obstructed, intubation is life-saving.
Right.
It's like using a life raft when the ship is sinking.
What's the prognosis after treatment?
With prompt treatment, most kids recover fully without long-term effects.
That's good to hear. So prevention involves monitoring symptoms closely?
Exactly. If a child's symptoms worsen after a few days, it's important to seek medical attention. Early action is
Definitely.
key.
Well, thanks for sharing this information. It's important to know.
You're welcome. Staying informed can make a big difference.
Absolutely.